In this video by Deckplate we will get information about general rating formula for diseases and injuries of the spine. Disclaimer: this video is for educational purpose only. It's not intended for doctor-patient or lawyer-client relationship. In the realm of veterans' benefits and disability evaluations, understanding the intricacies of disability ratings can be crucial for accessing the support they need. In this video, we break down the rating formula for diseases and injuries of the spine, providing clarity on what each percentage means for your condition. The role of spine. The spine is a complex network of bones and nerves which plays a vital role in our everyday movements. However, when injuries or diseases affect this delicate structure, it can lead to various degrees of disability. To navigate the world of spine disability ratings, let's delve into the rating formula provided for different scenarios. Unfavorable ankylosis, rating 100%. At the top of the scale is unfavorable ankylosis of the entire spine, resulting in a 100% disability rating. This indicates a severe impairment where the spine is completely immobile, significantly impacting mobility and quality of life. Thoracolumbar spine impairment, rating 50%. A 50% rating is assigned for unfavorable ankylosis of the entire thoracolumbar spine. This signifies a partial but substantial loss of mobility and function in the mid to lower back region. Cervical spine and forward flexion, rating 40% and 30%. A 40% rating is given for unfavorable ankylosis of the entire cervical spine or limited forward flexion of the thoracolumbar spine. Meanwhile, a 30% rating applies to limited forward flexion of the cervical spine. These ratings indicate significant but not complete impairment in mobility and flexibility. Range of motion and muscle spasms, rating 20%. A 20% rating covers a range of scenarios, including limited range of motion in the spine, muscle spasms, and abnormal spinal contours. While less severe than higher ratings, a 20% disability still has substantial impacts on daily activities and comfort. Moderate impairments, rating 10%. Lastly, a 10% rating is assigned to conditions such as moderate range of motion limitations or vertebral fractures with less severe loss of height. Though less severe, these impairments still warrant recognition and support. Unfavorable ankylosis and forward flexion. Before delving into the specific diagnostic codes, it's essential to grasp the concepts of unfavorable ankylosis and forward flexion. Ankylosis refers to the fusion or immobility of spinal segments, which can significantly impact mobility and functionality. The degree of ankylosis, whether partial or complete, directly influences the disability rating assigned. Forward flexion, on the other hand, denotes the ability to bend the spine forward. This motion is measured in degrees and serves as a crucial indicator of spinal function. The VA rating system considers the range of forward flexion as a key factor in determining the severity of disability. Now let's discuss the key diagnostic codes. Vertebral fracture or dislocation, 5235. This code covers injuries involving vertebral fractures or dislocations, which can result from trauma or degenerative conditions. Sacroiliac injury and weakness, 5236. Sacroiliac joint dysfunction and weakness are evaluated under this code, reflecting impairments in the lower back and pelvis. Lumbosacral or cervical strain, 5237. Strains in the lumbosacral or cervical region, often associated with muscle or ligament injuries, fall under this category. Spinal stenosis, 5238. Spinal stenosis, characterized by the narrowing of the spinal canal, can lead to compression of spinal nerves and subsequent symptoms. Spondylolisthesis or segmental instability, 5239. This code encompasses conditions involving vertebral slippage or instability, which can result in pain and neurological deficits. Ankylosing spondylitis, 5240. An inflammatory condition affecting the spine, ankylosing spondylitis leads to stiffness, pain, and eventual fusion of spinal segments. Spinal fusion, 5241. Surgical fusion of spinal segments, often performed to stabilize the spine, is evaluated under this diagnostic code. Degenerative arthritis and disc disease, 5242. This code covers degenerative changes in the spine, excluding intervertebral disc syndrome. Intervertebral disc syndrome, 5243. Disc herniation with compression or irritation of adjacent nerve roots is evaluated under this code. All other disc diagnoses are assessed under 5242. Formula for rating intervertebral disc syndrome based on incapacitating episodes: 60% rating. With incapacitating episodes having a total duration of at least 6 weeks during the past 12 months. 40% rating. With incapacitating episodes having a total duration of at least 4 weeks but less than 6 weeks during the past 12 months. 20% rating. With incapacitating episodes having a total duration of at least 2 weeks but less than 4 weeks during the past 12 months. 10% rating. With incapacitating episodes having a total duration of at least 1 week but less than 2 weeks during the past 12 months. Note: for purposes of evaluations under Diagnostic Code 5243, an incapacitating episode is a period of acute signs and symptoms due to intervertebral disc syndrome that requires bed rest prescribed by a physician and treatment by a physician. If intervertebral disc syndrome is present in more than one spinal segment, provided that the effects in each spinal segment are clearly distinct, evaluate each segment on the basis of incapacitating episodes or under the general rating formula for diseases and injuries of the spine, whichever method results in a higher evaluation for that segment. Thank you for watching this video. Please don't forget to subscribe and like our videos.